Okay, so this is, I think it's a really important call because we see it on the president's team chat. Those of you guys that are on the president's team chat, you're not there, right? It's maybe a goal of some of yours, but there is a lot of conversation like, okay, we're in a nutrition club and we got this kind of comment on our Facebook or our Instagram page, or have you guys ever encountered this with the health department? Or, hey, you guys, can I get any support with this when it comes to like, safety of the products? Does anybody have any recommendations for this? And so what Herbalife has done, you guys, we're on the phone with a lot of resources right now, and each person is going to kind of take a little bit of a role and share with you guys kind of like, okay, let's share an example here. And if you guys encountered this kind of example, what could you possibly do? And then here's a different example. And if you guys, and we're going to have different people talk to you guys. And if you encountered something with safety, or if you encountered something with social media, like what is the appropriate resource? Like what are the resources we have as distributors from the company? And like I'm going to share a few other things to you guys that we can do to prepare ourselves maybe from a social media perspective. So right now what I'm going to do is I'm going to turn the call over to Miss Anna Garcia, and she's going to lead us off with a PowerPoint. So Anna, over to you.
Hi, thank you, Amber. Thank you so much. Thank you, everyone. It's great to be here with you today. I'm glad to have this time to present this issues management PowerPoint with you. I'd like to take a moment to introduce our team members that collaborate on a lot of the issues that come through from negatives from social media, media relations, government affairs. So on the team, and NPC as well, and on the team we have myself, Anna Garcia. We have Jennifer Butler, who's a VP of Corporate Communications. We have Jonathan Soleimani, Director of Social Media for Corporate. Randa Popelka, VP Global Government Affairs. Yoshi Padilla, Senior Director for MPC. Blanca Barrera, Senior Manager for MPC. And Christy Alpahans, VP of Global Consumer Safety. So just wanted to take that moment to introduce the team, and we can get started with the PowerPoint. So today's presentation, as I mentioned, I just introduced the team. We'll talk about the presentation. The goal of this presentation is really to inform you of how we handle different situations that come across or come to us via MPC or to our emails. And some of these issues include social media, as I mentioned, from negative reviews to someone to an attack on our product, whether it be on your social channels. The other things can be from media relations, negative articles, government affairs, to having a health inspector come into your restaurant, and other things such as those examples. We can go to the next slide. Oh, and apologies. I just wanted to let you know that at the end of this, the team has put together a quick issues management guide, and that we'll present it at the end. That would also include links of where you can find that guide for future reference. So we'll start with social media, and with that, I'll pass it to Jonathan.
Thanks, Anna. And somebody else on our team as well from the social media team, Jessica Burrows, is on the call as well. She's our community manager, and a lot of times is the sort of first line of defense when it comes to negative content, attacks, etc. And we sort of bucket our negative attacks into three buckets: anti-MLM comments, negative reviews, and just general spamming, right? And this includes really anything that mentions our business model, pyramid schemes, anything like that we sort of see as negative or frankly nonsense most of the time, and are done by what we call trolls. I'm sure many of you have heard that term before. Can you go down to the next slide, please? Thank you. Here are some examples of some of the things we see on social media platforms, on message boards, etc. It can be a combination of attacking a specific shop, attacking the company in general, attacking our business model. It could be, there's a wide variety of things that we see. And a lot of times they actually are sort of copied and pasted from message boards or Facebook groups, like anti-MLM Facebook groups. Unfortunately, those are out there. And so these trolls will actually copy and paste information and then just start pushing it out as fast as they can to as many pages as they can. Next page, please. Thank you. And the first thing to remember, and I know this is actually a very hard thing to sometimes remember, is stay calm and don't respond. I think our first response or our first inclination is to hit them back hard, and defend, whether it's the nutrition club, the fit club, the company, the business model, your downline, whatever. And the first thing you should do, frankly, is to just not respond. What we sometimes joke about is that for social media, somebody's attention span or the news cycle is it's about the lifespan of a gnat. Only takes a couple of seconds, and people sort of move on. So the first thing you should do, don't respond. Take a screenshot of it, including the user's name and any other information you can provide, and then send it over to social@herbalife.com. That's an inbox that my team manages, and we will then take a look at whether or not there's anything that needs to happen. And then if you can, hide the comment, hide the review. If you can't, go ahead and delete it. It's better to hide it versus delete it. Hiding it essentially leaves it there, but nobody can see it, so that more people don't continue to attack it. Because the last thing you want to do is delete it, and then people see that you deleted it and then start commenting more and more and more. And the reason we say don't respond, frankly, is that on social media, if you respond and start a dialogue with some of these people, you've fallen into their trap of essentially putting a big spotlight on them. It's not about you, and you are not going to change their mind more than likely about what we do, your company, your business. In fact, what you will do is actually tell the platforms, the social media platforms, this is something that people want to engage with. Let's bring it up to the top and have more people see it. That's the opposite of what you want. Now, you may run into a situation where I believe it's reviews for nutrition clubs on Facebook. You can't delete it. You can't hide it. The best thing you can do actually at that point is disable your reviews for, let's say, a week to 10 days, so that you don't get this giant influx of reviews, and then eventually turn it back on and people won't see it again, and hopefully get some positive ones. And obviously, tell customers as you see them, make sure to write a positive review, and that will start pushing some things down as well. One more page, please. Thank you. So what happens when we see an issue? Look, as everybody knows, the internet is the universe. It goes on forever. We can't catch everything. It's not possible. But we look at a variety of third-party organizations, other companies, government entities. There are always ways to track as much of this information as we can. As we find out information, or the regions do, or another distributor does, as we're sort of notified, we notify MPC and or legal whenever we can. If it's on one of our channels, the ones we run, we'll sometimes just remove it or hide it. If it's something that makes sense to ask the user to remove, so for instance, if it came from media or something like that, the media team will talk about that. We can go and ask them to remove it. If it's an opportunity to educate somebody on claims or product information or something like that, we'll also do that. Obviously, as I said, we'll hide social media comments if it's on one of our channels. The media relations team can contact the media outlets. Distributor leadership is notified as necessary. The region is notified as necessary. But more often than not, a lot of times it's just don't respond, let it die out. People move on relatively quickly. So there we go. That's it for me. Back to you guys.
Randall, you're up.
Okay, so thanks for having me today. So let's talk about government affairs. Go ahead and go to the next slide. So what we do in government affairs is we work with a number of different government regulators. We work with members of Congress. We work with state health departments at all levels of government. I work with municipal level elected officials and government officials. So I work with anybody where they need to have an interest in our product, have an interest in our brand, and would like to know more about it. We respond to the regulatory inquiries as they come in, and this is both on the business model and on the product. I'm seeing more and more of this on the product from the perspective of we've seen a tremendous growth in our nutrition clubs in the U.S. over the last couple of years now. Well, along with that growth, you're also going to see an increase in the regulatory interest in our nutrition clubs and the products that you guys are serving. So we expect that to continue. Talking about that internally, how we can help you be more proactive with these states, be more proactive with the municipal governments, and just give you more protection from that. We work with the regulators to educate and understand our product. and how all of our product is in compliance with food law. And this is really, and we'll talk about this in a moment on the next slide. But one of the primary issues that I hear over and over again is that an inspector will walk into a club, and this is at a very grassroots level. An inspector will walk into a club, say in the city of Spokane, because I'm dealing with that issue right now, and say, your dietary supplements that you're using in these products aren't approved by the FDA. First and foremost, let me just assure all of you, you need to have confidence in the product. We've got super smart people here like Dr. Applehans, who's on this call right now. We've got great science, we've got great research. All of our products are in compliance with FDA, the FDA food law. Okay, and so I walk them through that, and I say, first of all, yes, all of our products are in compliance, and if you have a specific interest, I will walk you through each individual product. And then the last point I have here is that we collaborate with industry and government to protect our presence. And what I mean by that is that there's always attacks on our business model. There's attacks on our product. It's just a constant, right? It's not just us; it's everybody else in the industry. So, from a nutrition perspective, from a business model perspective, we are constantly working together as an industry. So I work with the folks up at Amway, USANA, with their they've got nutrition products. From a business model perspective, Nu Skin and Mary Kay, even though they're cosmetics, they still have the same business model. So we're constantly collaborating and working together to protect you, the distributor, protect the brand, and protect your ability to be an entrepreneur. Next slide, please. So some of the reasons that a health inspector might walk into your club is that, obviously someone could file a complaint, or, it could just be a regular inspection. So we've had situations where, a consumer has walked into a club and said, I've never been in here before. What is this? What are you serving? And decided to take an interest in it, or maybe they didn't like something that happened in the club, or maybe it's a neighbor that doesn't like the club. It can be any sort of reason, right? And so all they have to do is file a complaint. Once they file that complaint, it sets in a series of motions where you've got an inspector that comes there. The inspector doesn't necessarily understand the product. They don't understand our compliance with the FDA food code. And so you'll get an inspector who may be pleasant, may not be pleasant. I've worked with all different types, and you're not dealing with somebody who necessarily has a strong sophistication on our product, so they're not necessarily going to fully understand how a dietary supplement is categorized by the FDA, right? A dietary supplement is essentially a subset of food within the FDA food code. It's not an additive. They like to call us additives. We're not an additive. It's an add-in product, and typically, whenever I talk to an inspector, it's interesting for me, because what I'll typically run into is I'll run into an inspector saying, you can't add this liftoff product into a shake because the consumer doesn't know what's in the product. Number one, we certainly encourage everybody to in fact, I think there's MPC has a rule on it to disclose what is in every shake, right? Especially when you have a caffeine-based product. But it's an add-in product. So the example that I typically will use, it's like, well, listen, if you walk into a Jamba Juice or a Robix, right, or in a more retail type of a shake shop, and they have at the bottom of their menu, it says at the bottom, if you would like a heart healthy or an immunity or protein add-in, you can add it in, and here's the caloric value and here's the cost of it. They don't say anything more than that, right? So we even go farther than those guys do, but yet we get the scrutiny. So there could be concerns over our product ingredients. There's always licensing and permitting issues. And so those are some of the things that we work with when we were talking to the inspectors. Next slide, please. So here are some of the examples. Earlier this year, for any of you that are in the state of Virginia, we had probably a 4-month discussion with the state of Virginia and the FDA, and I had to go pull in some members of Congress to help us and some state legislators. I mean, it was a full out effort on it was 4 months of this, and they were initially just concerned about our Aminogen product, right? And so the Aminogen product includes an ingredient called protease. That's the primary ingredient in it, and protease is an enzyme. Well, the inspectors, they don't know this. They don't know what protease is. They don't know, what an enzyme is. They just don't understand this. And so they wanted to know more about that. But what they're doing is they're walking in and they're saying, you can't serve this product because it's not FDA approved. Gets back to what I said before. It's like we've got all of the, you know, the paperwork, we've got everything that we need to show that we are in compliance with FDA guidance. And it just took a long time to get to that point because, you know, the state wanted to get certain, assurances from the FDA, which eventually happened. But it just took quite a while. So another example here in the middle, a municipal health department banned all dietary supplements served throughout their area of jurisdiction. That's the city of Spokane. I'm dealing with it right now. We had several conversations with both the state health department in Washington and the city of Spokane. And, basically said, look, it's very unfair for you to say, that, all dietary supplements are banned when there's not been any consumer complaints, there's not been any health risks, posed. You have no reason to do this. And so they sent out another notification to all of our clubs and everybody else in the Spokane area saying, okay, you can serve them for now, but we're going to look into this. I'm still working on that issue and it will be resolved, hopefully in the next couple of weeks. And then the last one, like I said before, every inspector starts with, these products aren't FDA approved. Well, absolutely they are. And so look, have confidence in the product, have confidence in the brand. I wouldn't get into this conversation with the inspector. I wouldn't start talking about the FDA food code. I would say, let us get back to you. Collect the inspector's contact information, get their card, and then go through MPC, and then MPC and I will work together on it, and we'll help to resolve that issue for you. Next page, please. So learn what to do with the government official, such as a health inspector contacts you about products or brand related issues. Number one, first and foremost, regardless of their demeanor, regardless of their of who they what they're saying to you and how threatening they may seem, look, just be nice to them. There's no reason to be afraid. Just be pleasant and be nice and be responsive as you're able to, and say, let me get back to you. Let me get back to you. We can resolve this, and then reach out to us. Really, what I do, if somebody calls me and says, I have an inspector that just walked in, and they have a problem because I have 2 sinks. I have 2 sinks and I need 3 sinks. That's an individual club issue, right? A nutrition club issue. I'm not going to get involved in that because that's something that you just fix on the spot. It's like you address that as an individual operator. If it's more systemic, if it's something that's going to affect the brand and hit multiple nutrition clubs, that's where I'm going to step in and say, okay, we can help you with the brand. We can help you with the products, the ingredients of the products, and how we're compliant with FDA food code. So when the inspector walks in, like I say, just be confident, be nice, collect information, and work with MPC, and we'll help to resolve that problem. Next page, please. So we've put together some documents. There's a couple of guides. I think there was one guide. I haven't looked at these for a while. We've got to look at them and possibly even consider improving them, because we've had them out to you guys for a while now, and would love to have some feedback on them. But one is for the distributors themselves, the nutrition club operators, and just giving kind of guidelines on how to respond to these inspectors when they walk in. And then the other one's for the inspectors themselves, and that will provide the inspector with contact information for the company, and they can reach out to us if they'd like more information on the product. Next page, please. So how does the team manage the issue? Once we're made of the issue, once we're made aware of the issue, we'll reach out independently to the government office. So I'll call the inspector, right? I'll call directly to the inspector. The inspector usually doesn't have the answers that I have, because again, we're not talking, these are people that are just on the ground. They don't really know a lot about the FDA food code. And I don't want to sit there and it's not my job to make people, feel bad about, their level of knowledge. They've got a broad swath of issues that they're dealing with. So I'll just say, look, let me just work with, your boss. Let me work with, the city. Let me work with the state. I can help to resolve this. And, I always say to them, it's like, look, we have the same role. We all want to protect our customers, corporate distributors, we all have the same role. We in the regulators, we all want to protect our consumers. So, let us cooperate with you. Let us work together with you, and we'll resolve these issues. We work with the office. We provide them labeling information. Yeah. So, so typically you can, just say it like on the liftoff tablet. I always like to use the liftoff because they're always perplexed by our liftoff tablet. But it's just a vitamin B and caffeine-based energy drink. That's what it is. And it's it's a much better energy drink than you're typically going to even get with a cup of coffee. And then the fact that it's an effervescent tablet and it fizzes up, and you drop it into the shake, and it's something that they haven't seen before, something that they don't have much knowledge about, and so they want to know more about it. In the case that we cannot come to an agreement, and this goes back to the state of Virginia I was talking about, we engage our stakeholders, FDA contacts. I work with what's called the Office of Dietary Supplements of the FDA. And fairly regularly, I work with a trade association called the Council for Responsible Nutrition. These folks can help us in terms of being a third party to engage and help us to resolve these issues. And then, like I say, I work at all levels, local, state health departments. I brought a congressional office in who has oversight over the FDA, and they were very helpful to us in the state of Virginia as well. Next slide, please. Let me see if there's a question here.
Yeah, Randall, let me just,
Okay.
I get what this question is coming from. So we've always been educated as distributors to not say we're approved by the FDA, right? And I'm clear that there's a difference between food grade and maybe pharmaceutical grade and what the approval process is. And so I think at one point, you're basically saying, Randall, be confident. Whatever standards we need to meet with the Food and Drug Administration, we meet them. I'm also hearing, but it's not your role, distributors, to have the conversation with this regulatory person that walks in your club. So do you just want to explain that process? I think they're saying, do you get what I think they're saying is like, oh, I thought we weren't approved.
Yeah, so look, I mean, let me provide some clarity.
Okay.
The FDA doesn't approve any food, right? The FDA doesn't approve a bag of Cheetos, okay? The FDA doesn't approve a hot dog. The FDA, if you really want to get into it, you talk about, the compliance with the FDA food code. It's a very vague law, right? There's not a tremendous amount of clarity around the law itself, so it's hard to have that conversation. When I say this, the inspector will walk in and they'll say, "You're not approved by the FDA." When I say that, it means that the inspector is wrong, because the FDA technically doesn't approve any food, right? They will approve ingredients. They'll approve certain ingredients. Another example on that is collagen, our collagen product, right? So our collagen product, they said our collagen product wasn't FDA approved. Our collagen product is based on a pig gelatin ingredient. That was an FDA approved ingredient starting back in 1993. In fact, all collagens are really based on a pig gelatin. I'm sure there's other types of ingredients, but that's the primary ingredient. It's a pig gelatin, porcine gelatin. And so you don't want to get into the tit for tat. It's like, well, you're not approved. You don't have FDA approved products. Yes, we do. We don't. It's like, that's when you just say, look, let us get back to you on this. It's a very vague law. The food law is very vague, but again, it's a difficult conversation to have in the nutrition club with the inspector sitting right there.
And Randall, this is what I think. If I'm doing an H1, for example, and I'm talking about our products in an Herbalife Opportunity meeting, and I'm talking about the confidence in our products, right? So I'm thinking I'm not going to say something like, "Hey, you guys, just know that we're FDA approved." I'm certainly not going to say that in my Herbalife Opportunity meeting, but I might show the catalog, and I might show our nutrition advisory board and our physicians and stuff like that, and talk about like the confidence in the products with our scientific advisory board. Now, I think you guys, for the purpose of this call, Randall's just basically saying, somebody comes in and they say, "Hey, you're not FDA approved." You say, "You know what? I understand why you might be thinking that. Let me just get back to you. I'm going to get in contact with our company and let's just work it out. But let me just get back to you." Just don't engage in the argument with them about the FDA approval or non-approval process.
I never say to anybody that our products are FDA approved. Okay. Right. I say we're in compliance with the FDA food code, but you don't even want to go that far, right? just tell them, that you'll get back to them. Right. So it's like I say, it's a very vague subject to talk about, and just say, we'll get back to you on that. It's, you don't want to get stuck into this conversation where you're trying to explain, our product and the ingredients in our product.
Perfect. Awesome, Randall. Okay. All right.
I
And
think that was it for the,
is that it for you, Randall?
sorry?
Is that it for you?
Yeah, that's it for me, yes.
Okay, well, I mean, you don't fall short from the, I don't know, like all of the, thank you. I'm just like, I'm so glad that you're on the Herbalife team after I saw all that. I was like, all right, this guy's a keeper. Let's keep this guy. So thank you. That was awesome. Okay, I'm going to go back. Okay, they're asking for more clarity. Randall, you're not done. They're asking for more clarity. The FDA approves medication and regulates food. We are food. Why don't we just give them the simple answer? Do you get what they're saying? They're saying, why can't we just give them the simple answer? And I'm saying, I'm going to answer, and then you can answer. I'm saying, don't engage. It's an entertaining battle. Stop engaging. Just call the company.
Look, they're never going to believe you anyway. Even when I tell them, even when I say, look, we're in compliance with FDA guidance, they're not going to believe me. They're going to go to the FDA. They're going to listen to me, talk about it, and I'm going to explain how we're in compliance. I'm going to show them all of the compliance documents that we work with on each individual product. And then they're still going to go back to the FDA and wait for an answer from the FDA. Don't engage with them on our product. It gets much too complicated. You guys focus on you being entrepreneurs, running your businesses. We'll take care of that. Just, send them to us on products.
Awesome. Yes. Guys, we've been around for 41 years and we've been okay for 41 years not saying it. I think we're A-okay. I don't think we need to have the confirmation to make that particular statement. So Randall, thank you. Okay, Jonathan, are you still alive with it? There you are. Can I ask you a few questions?
Sure.
So I remember asking you when we were talking on this setup call, for example, when people email the social at Herbalife, like maybe they take the screenshot of what was posted on their Facebook or their Instagram, and they take a screenshot and they send it to the social@herbalife.com. I said to you, I'm like, Jonathan, it's not likely that they're going to get a response. Is that true? I just want to set them up so that they know whether they should or should not expect a response from that particular email address.
Yeah, it really depends on the situation. If it's something that we can't look, we're not going to guarantee we're going to respond to every single person because I have no idea how many emails are going to come in now that we've sort of given everybody this email address. But if it's something that we can give advice on, if it's something that does require legal or MPC or something like that, they may not get a response directly from social@herbalife.com, but they may be connected with somebody else within the organization who can help.
Okay. Perfect. Yeah, I just want you guys to know, you may they received it, but that doesn't necessarily mean that, and you guys, I've connected Jonathan recently with a few situations, quite honestly, that were pretty extreme situations with Facebook. And I mean, they're like, listen, there gives a little bit of advice, like maybe do this or do this or do this, but basically you know what I mean? Jonathan, he doesn't have a magic wand to call Facebook and make it all okay. I'd be awesome, but right? It doesn't work that way.
That's a very good point. I don't own Facebook. Some days I wish I did, but they, once you get in touch with them to fix a problem or whatever it is, they're the ones that own it. They're the ones that have access to the platform. It's not really us. We can give you guys certainly advice if there's questions. And then there was another question about reading content on Google and if it's true or not. How do we handle this type of question? Okay. So that's a difficult one to answer because Google is really just a search engine, right? So what you're saying is people read something on the internet. Just like anything, whether it's medical advice or fitness advice or, parenting advice, you have to look at where the information is coming from. Is it from a reputable source? Is it coming from an actual news site? Or is it coming from, somebody's blog? So it's kind of difficult to answer that question without getting more information. But what I would suggest is get more information from them.
Perfect. Okay, Jonathan, I just wanted to share one thing too. We were talking about this, you guys. And when Jonathan mentioned you guys, so I'm just going to use Facebook for an example. Okay. So if you guys see that somebody has posted a comment on a post, a comment on a post, you guys. Okay. There are these keywords, and I'm not sure, maybe I'll say that I'm going to look in the PowerPoint, you guys. I don't think I see them in the PowerPoint, but there's these keywords that in our organization, we have our organization go to the back end of Facebook and Instagram and type all of these keywords in. So for example, they're like keywords like MLM, toxic, pyramid, liver, just there's a lot of keywords. And what means is if there is somebody that attempts to go on I'm just going to use our Nutrition Club Facebook page, but it could also be like we have a coach like Amber and Jason coach Facebook business page as well, that if somebody types in one of those words on a comment on a post, they won't be able to post it, okay? Because we have these blocked keywords on the back end of our Facebook or our Instagram, okay? Now, let me go over here, and Jonathan mentioned it, but I just want to be clear, you guys. If somebody goes and there is this section called recommendation, right? Like they're going to recommend, somebody's going to, recommend Daily Dose or Nutrition Club. If they go to recommendations and they write a recommendation, you guys, they can post whatever they want. The keywords don't apply to that category. So you heard Jonathan say that. Like the minute you see a recommendation come in, and it maybe is some anti-MLM person or group, right? And it's almost like when they strike, this is what we notice in our organization. It's like when they strike and they get one, right? Then I don't know what happens on the back end of their little anti-MLM structure, right? What did you call them, Jonathan? You called them trolls, right?
Oh.
Trolls, okay? I don't know what happens in troll land, but whatever happens, you guys, all of a sudden it's like bam, 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 and all of these negative reviews come in. So we teach our team, the minute you see one negative review or recommendation, go to the back end of Facebook or go, I don't believe it's applicable on Instagram, but it is applicable on Facebook, and shut your reviews off and leave them off for 7 days or 10 days, you guys. And Jonathan's right, you guys, they'll just go find someone else. Now, sadly, they're going to go find someone else, and it's one of you guys, and we're all counterparts to each other. But we just have to be in the game together. Does that make sense? So we have to be aware that when they strike on one, just go shut the reviews off, because like Jonathan said, the minute they strike and they get a little bit of traction, then Facebook, what's it called, Jonathan? Like Facebook, like shows them more. Does that make sense? Like,
yeah, they'll highlight them more once they start getting a bunch of comments and engagement. Yeah. They'll actually push them up to the top a lot of times.
Okay, yeah. So let's not let that happen, you guys. Just go to the back end and shut your reviews off. Okay, it happened. It was so weird, you guys. It happened to one of our brand new nutrition clubs, maybe like 2.5, 3 months ago. It's 10 a.m. on day one. Okay, this nutrition club is down where I live in Florida. Okay, and they get one review, and the review is from somebody in like Vermont. Okay, day one, 10 a.m. It's a negative review. We're like, okay, it's day one that the nutrition club opens. It's in Florida. The review comes from a person that lives in Vermont, and the owner knew right away. It was like one and done. And she went to the back end and she shut that sucker down. Okay, because she knew, because we just trained our team well enough. So, okay, we'll get you guys those keywords here sometime. If it's not on this call, we'll get them to you. Okay, Jonathan, anything else? I think that's all I had for you.
No, that's it for me.
Okay, great.
Thank you. And we did get a comment under saying that, not a question, but it is applicable for Instagram as well. So let's say if you could do something like that. And then there was a question if it's also applicable for Google reviews. I'm not sure about that. And I don't know if anybody here knows if Google review has that. We'd have to go back and check for sure.
If I remember it correctly, and Amber, you've clearly done this recently, what you're talking about is very, very specific to Facebook reviews, correct?
And Instagram. It's Facebook and blocked keywords on Facebook and Instagram. I do not believe you can block keywords on Google.
Right.
Okay. And then the review portion, Jonathan, is very specific to Facebook only. Yes.
Yeah, that's what I thought. Okay.
I have not said the keywords yet, but I will, you guys. Just give me a hot second and we'll get through everybody, and I'll give you guys the keywords that we use in our organization for sure. Yes. Okay, Anna, I'll turn it over to you to bring up the next speaker.
Thank you. Next, we have Yoshi Padilla from Member Business Practices and Compliance. Yoshi.
Thank you, Anna. This is great information, by the way. We get these types of questions all the time. And so I really encourage everybody before I get into my section. I just want to encourage everybody to take a lot of notes. I don't know if we're going to share this deck anywhere later, but I hope we can, because it's a great point of reference for any of your organization that hasn't been on. These are all tips and tricks. There's not a one fit solution to any of these topics. You're going to have to kind of learn. Unfortunately, we're in the world of social media now, and it's a beast for sure. So all of these little things are going to be extremely helpful. But I think my biggest takeaway from what I'm hearing from the team is just don't engage. Do your I know it's so hard. I'm that type of person that wants to kind of respond, but that's not true. We've got to set the record straight. But the reality is that does more harm than good, because these folks are not in there for the truth. They're in there to cause disruption and get their opinions out there and be noticed for that. So really great tips and tricks. I just want to kind of state that because it was really neat. I've been on the prep calls, but just hearing it again and hearing in the context that we're sharing it, it's just powerful information. So with that being said, let me just get into my section. For those of you that don't know me, my name is Yoshi Padilla. I am the Senior Director for Member Business Practices and Compliance. So the ambassador program, anything to do with any type of a case file, bottom line is our objective is to ensure that you, our distributors, are compliant within our rules, right? That you operate with a high level of customer protection and service, that you're able to thrive within the industry, demonstrating a level playing field. Okay, so this is our role in a nutshell. And I know that most of these social media stuff ends up coming to MPC, and we're happy to filter that out. But we do share that with public relations, and they've already shared kind of their process and how they handle each one of these cases. So with that being said, let's go to the next slide. So the question that I get most often is, how does MPC or member business practice and compliance handle complaints, or how do we manage our complaints, right? So this is kind of our process in a nutshell. Happy to answer any questions, but the way that it works is that we review each complaint that comes in, just to ensure that it's an actual violation of our rules, because oftentimes we get a lot of complaints, guys, that actually is not a violation. This is more of a best practice, or maybe a grievance more on a personal nature. Sometimes it's not a rule violation. So we don't want to open, case files and go through the investigation process on something that is truly not a rule violation. So we make that determination first. But regardless, every single complaint is going to receive an acknowledgement letter. So keep an eye out for that. And it's generally received via email. And it basically says, hey, we've got your complaint, guys, and we're addressing it. Sorry, guys, I'm my door open and I have somebody passing by there. So background noise, that's what that is. So anyways, so that's what happens there. If you don't receive an acknowledgement letter when you've submitted a formal complaint, that's a trigger for you to follow back up with us and say, hey, listen, I didn't receive a letter. Maybe we have the wrong email on file, because that goes to the email that we have on file. So I would highly encourage you to follow up. And you should receive that within 3 business days of submitting the complaint. The next thing that happens is that we're going to start to inquire with the alleged distributor, right? We're going to allow them to we're going to provide them an opportunity to respond to the issue that was brought up. We're going to coach accordingly, and then we're going to request a correction. All right. Once that is resolved, we go to the process of resolving the issue completely. So if a sanction applies, so for example, if this is the second, maybe third time with each issue that is brought to our attention, the sanction gets a little bit more, more serious, because we're going to give everybody the benefit of the doubt from the very beginning and assume that they just weren't aware of the rule. So we're going to train and coach, and that's how we handle most of those complaints. But depending on the complaint that is received, and we can prove it, we're going to apply a sanction based on the second, third violation and the type of a violation of the rule. And then that process gets resolved. What's missing on this chart is you should also receive a resolution letter. So 1, you're going to get a letter to acknowledge, hey, we received your complaint. And then 2, you should be receiving, hey, this has been resolved. So if you see this happening again after you've received this letter, please let us know. And we're going to handle that as a second complaint. Because oftentimes I think that's the biggest misconception is I hear, hey, I reported this and you guys aren't doing anything. Well, in most cases, we do something about it. And in most cases, it's going to be a coaching. And by the time that you see that happening again, it's likely a second offense. They're just continuing to do it for whatever reason. And so this is really important. And that's why that resolution letter is extremely important, because once you receive that, if you still see that happening, let us know. And we're going to handle this with a little bit more of a higher consequence, if you will. Okay. So that's how we manage our complaints. And I think I have one more slide on here. So Herbalife nutrition rule violations. So again, any other concerns with a nutrition club operator or a distributor can be reported directly to MPC. And then here's the information to send those complaints to. There's a variety of different ways, but this is the best way to do it. You can also do it through your local ambassador. And again, it doesn't matter if you do it through your local ambassador or you submit it through the DPC or complaints. We just never changed that. Should be MPC complaints, but distributor, it used to be distributor member compliance, Anyways, DPC complaints NAM, or the phone, or you call directly to the 866 number. Any one of those ways should follow the process that we just shared. So you should receive that acknowledgement letter. You should receive that resolution letter once it's resolved. That it doesn't really matter the way that we receive the complaint. This is the best way to submit it, but it doesn't really matter which way you submit it. That process should remain the same. So hope that makes sense. Any questions for me? Pretty straightforward. All right. Well, thank you for that. Back to you, Anna.
Thank you, Yoshi. And next, I'm next, as a matter of fact, to speak on media relations. And I've got my colleague, Jennifer Butler, as well on here. So, okay, so we'll start with comment attacks, what some of the comment attacks include on the brand, obviously. So let me just say this. We are very passionate about our company. Our goal is to protect the brand, protect the business, build brand reputation so that you can do business as a distributor. And that's what we're here to do. And, this is why this PowerPoint is so important, just so that to show you that it's a group behind you. It's just not you alone, but we are here to help you. So you are not alone in this. Common attacks, which, we're familiar with, are negative news about our company, our products, false claims, etc. And we work together with this group whenever something starts to boil to the top. Sometimes it can be something that appears, all of this is interconnected. So sometimes it could be something that appears on social media that can, cause a media outlet to kind of, pique the interest of a media outlet, from there turn into a news article. And we've seen that happen. And sometimes, we've got to bring certain, team members in for that as well. So next slide. These are some examples of some of the negative articles that we've seen that our team pushes back on. We are sometimes alerted via email, from MPC will alert us. We also, to some of these concerns that they've seen, or if a distributor have seen an article and it comes to us, we look at it and to determine what the proper steps are. So these articles, when you look, these are some that we deal with, some of the nutrition clubs that are opening. We deal with, can Herbalife damage your kidneys? We, look into these articles, investigate, and do what we have to do. Then the third one, which is one that many people can look at this and it'll say like editorials, this is from the editor. When people see this, they think, oh, this is a publication. They wrote it. Actually, this is a blog. This is a blog. This was written by a blogger. When you start your blog, you can refer yourself as a managing director, editor, whatever it is you like. So that's another reason why we go in there. We investigate where the source, who the source of this article is, how far they reach. Are they a credible media source? Next slide.
Can I just jump in here really quickly?
Yes.
So on that second article where it talks about can Herbalife damage your kidneys? So when we see like product attacks like this, you have to know that we wake up in the morning, we get these daily alerts at 5 a.m. We are actively on the phones as soon as we see these negative articles. If we didn't work with the reporter in advance. And my first call is always to Dr. Kritzy Appelhans from the product safety team. And we will come together to come up with a response to push back on the article. Because in the media world, you have to push back within 24 hours or they really can't change articles. So we are always monitoring the news. We're always keeping an eye out for any type of coverage we get when we're not proactively pitching the company as well.
Absolutely. Next slide.
Yeah.
So when we receive reports about a negative media articles, I mean, obviously we have to do the same thing that we ask you to do, is to keep calm. We ask that you don't respond, do not reach out to the publication, as this can generate more attention and just not resolve itself in the positive manner for your business and for the company. So we ask that you take a screenshot of the article, copy the link, send it to our email there that we have, media@herbalife.com, or call the 1-866 number. And then from there, we can go on to the next slide. as the next slide talks about how we manage this issue. So once we receive the email, we review the article to identify false, misleading facts, slanderous information. We research publication, as I've mentioned, decide on the best course of action. As Jen just, a great example that just provided, if it's something having to do with a health concern that somebody is claiming that was caused by our product, we work closely with Global Consumer Safety Team. We contact the reporter to push back on the point of accuracies. And that's when we, if need be, we make sure that we gather our points together and we're prepared to, I like to say, if needed, go into battle. If appropriate, we offer an interview with executives to correct the article, and also respond with correct information, as I mentioned. So this is really imperative. And when we get the email letting us know about these articles, we're not always able to respond to the person unless it's an issue that we realize is bigger than and need more information. Then we contact and let them know, try to gather more information from the distributor. It's contacting the person that submits a claim is on a case-by-case basis, similar to social media. Next slide, please.
Oftentimes when we get these things, we have to spring into action really quickly. If you catch something, we don't, because we have that really short time in which to turn these stories around.
Exactly. Next slide, please. Okay, and with this, we have Global Consumer Safety, Dr. Christy Appelhans, you're up.
All right. Thank you so much, Jen and Anna, and of course, everybody. This is a perfect segue into the global consumer safety section, I think. For those of you who are not already familiar, we're a group of health and science experts who are actually responsible for managing consumer health and safety worldwide. And we do this by evaluating feedback that we receive from distributors and your customers. So as you can imagine, we frequently lead or collaborate with all of the teams on here to make sure you have accurate and useful information to share when these urgent issues happen in the media or otherwise. And next slide. I think it's Claudia's. Thank you. So first of all, I just wanted to give you a quick overview of the most common types of questions or concerns that the Global Consumer Safety team handles in either responding directly to you or your customers if you want us to do that. And we also may be pulled in to support as part of the more cross-functional process described by my colleagues today. So first of all, you see here under scientific articles, number one, liver damage is obviously listed. That's at the top of everybody's radar as the most alarming or inflammatory type of news that they can see pop up on their social media or Facebook. But there are obviously other types of concerns. Anna, I think you just highlighted, renal toxicity or some other kind of health complaint. And there are a number of them that can come up. So we certainly can address the variety of health or safety related issues that arise and give some talking points as to what, consumer expectations should be in regard to any health related condition. And number two here, this is a really frequent concern, people who have health conditions, they're using medication, they're concerned about side effects. By the way, Amber, I think that's one of the key words that should be on the list if we haven't already finalized that list. Side effects is often a really frequent inquiry that we get around our brand. And also ingredient interactions, how our ingredients may interact with one another, and certainly how they interact with other types of products and or medications. And then number three here, you can see that best practices is listed. And this is one that we are certainly working closely with the MPC, legal, government affairs, and others to just make sure that people have the best product use experiences by, really drilling in on those product mixing practices, storage even of your products to make sure that they maintain their shelf life and in a way that, is going to have the best product experience, and also hygiene, after you're preparing them, what kind of temperatures you should be keeping them in, how long you should keep a mixture out and stuff like that, before you introduce some risks, for product hygiene related issues. And then number four here is product label information. And a lot of people don't don't readily acknowledge how useful a product label can really be. It's got a lot of information on there: allergens, ingredients, preparation method, and also warnings and precautions if they apply to a particular product. And this can be a really useful way of walking through some dietary restrictions that people may have, especially as it relates to allergies or ingredient intolerances. And it's a great way that, if someone's pushing back on not being able to use a product or questioning whether we have certain ingredients or not, you can walk them through that process, and you're going to be very well versed and show your ability to customize their plan for them. And it's just a great way to really engage with at the customer level. And then the final one here is product quality and sourcing. So there's a lot of questions about where our ingredients come from, whether they're the right ingredients, are they GMO, and do we have traceability capabilities within our manufacturing practices? What does set us apart from other companies? That's also a very frequent question, not just what's wrong with our product, but what's right about our product. And we certainly have all those talking points to offer as well. Next slide, please. All right, so as I mentioned, and as shown on the slide here, we have experts ready to support you one-on-one. So we can do this through a variety of communication platforms, and I'll certainly introduce those towards the end of the deck here, but we're also committed to learning from our experiences with you. So all the questions that we get are actually tracked by the region and by topic. So everywhere in the world that we're getting inquiries, any of the ones that I listed out on the previous slide or otherwise, we're using these to create metrics so that we can actually prioritize the creation of content around safety and product quality and disseminate that content accordingly through new tools or trainings, just so that we can best support you through your most frequent and or sensitive issues that arise in your organizations. Next slide, please. So this is just a really brief summary of what happens when you contact GCS. And again, I'll tell you how to do that here in a minute. But basically, we will activate a variety of experts as needed to be able to respond back. So whatever information that is needed, it might take a little bit of research on our part, or we need to engage with other departments like the ones you see here or others, but we'll make sure that we're getting a response that's actually appropriate to the question and hopefully answers all the parts of the question that you or your customer had. And then once we have the information gathered, it'll be a customized response. So, we don't believe in canned responses, although, we certainly have some standard talking points, but we try to make sure that we're engaging in a way that really, digs into the concern that your customer or you may have. And then for 3 and 4, like I mentioned on the last slide, this is an informed process. So the more we ask, the more we're asked for support, the more we can track and the more that we can prioritize and develop content and tools and trainings. So that will help us proactively develop self-service tools for you as well. Next slide, please. Now, I hope this one doesn't look too scary, but I used it as my primary example because this is actually a situation that impacted, Randall can correct me if I'm wrong, or Jen, impacted like every region. It was an article that came out of India and in the Journal of Clinical and Experimental Hepatology, but it spread, through the media and through our government relations activities, and of course on the consumer side and social media. And it really activated all of the stakeholders that are on this call here today and many others. And so what we did is we made sure that we were well organized in all the ways that we've discussed here today. And I just want to go through here on the next slide the ways that we actually engaged. And as you can see, that little nasty article was actually removed from publication, but it took quite a bit of doing to get that to happen. So we had a lot of parallel activities. Go ahead and change to the next slide there. So as you can,
The
go
correct
ahead.
slide? Yes, I just want to make sure we're on the correct slide now.
Yes, we are.
Perfect.
We're on track. So as you can see here, there's a cross-functional team, as we've been mentioning, working together. And the first thing we did was compile a comprehensive point-by-point rebuttal, because we're going to go and push back against the journal and of course its author, the authors of that article. So we wanted to make sure we had a very robust scientific and safety and quality related response that would actually address each of the concerns that were addressed in that article. So then in parallel, we had to make sure that our rebuttal points were written into a consumer friendly format. So, all along the time that, this was published and that it was kept in publication until we were actually able to remove the article, lots of questions and concerns started arising at the consumer level, obviously. So we wanted to make sure that distributors were well armed with information and Q&As to, address this very sensitive matter if and when it came to their attention. And we also demonstrated that our products were fully compliant, as Randall was talking about earlier, with all the quality and safety requirements that are mandated by regulations, not only in India, but also other countries where regulatory inquiries arose as a result of this article. And then on the bottom here, you can see that we actually had a lot of existing, thanks to the good work that all of our corporate affairs teams do, we had a lot of existing relationships with governments around the world. So we were certainly engaging as a company to be able to build their confidence around this particular issue and make sure they understood that these were misconceptions and inaccuracies that we were well prepared to address. And to that end, we also made sure that we tested all of our products in this moment to make sure that they knew that current testing outcomes actually showed that our products fully complied with all the expectations from a quality and safety perspective. So that was a very powerful all hands on deck response that we were able to activate by the company. Now, it wasn't just the in the moment response, though, that I think was so impactful, as far as the team's collaboration goes. It was also what we're calling here the life cycle of the response. So as I mentioned, we're always learning from these activities, even if we're very mature in our crisis management protocols, there's always something to do better next time. And in this particular incident, it occurred to us that it was important to enhance public awareness around how wonderful our product and brand really is, right? So we did an awareness campaign, again, with multiple stakeholders to make sure people understood what kind of industry-leading quality and safety measures were in place to ensure consumer safety. And that was through a number of efforts that probably is its own training altogether, just so you guys are aware of all the resources and content out there that actually address this subject. But it was very powerful, I think, in helping to erase some of those misconceptions that we struggle with. And certainly there's more of that work coming. We understand how important it is. And it also triggered, of course, Jen and Anna can speak to this, but it triggered a crisis comms plan, and they coordinated all the protocol responses, but also socialized that with all of the regions so that everybody could be well coordinated moving forward, no matter what market you were operating from.
Just to add what Christy said, it's just so important that we're all saying the same thing when it's because we never want to have disparate messages out there. So it's just very, very important that we all work together to ensure we are singing from the same song sheet and always following the key messages that are pushed out from corporate.
Absolutely, Jen. That is very important. And that's actually one of the things that, the Global Consumer Safety team does, is it takes all of this information that we compile in response to, different topics, and make sure it's rolled out consistently around the world so that all employees have those things to use if and when these things occur. Next slide, please. All right. And as promised, these are all the different ways that you can contact us. So hopefully this doesn't come across as confusing, but convenient. There's a number of ways that you can access GCS's support. And you can certainly call, or your downline can call through member services. There's still an active line dedicated to press team. You can also go online to the support center that's in myherbalife.com. We also have one on herbalife.com if a customer needs to search out an answer or look for some information. But if you don't find what you're looking for there, you can also use the contact us sheet and submit a question. And that comes straight to our department. And then we route the right expertise back out to you to be able to address that question. And if that is not something that you want to engage in and you just want to email us, our email is there too. So it's just a matter of what your preference is. But there is a lot of information online. So you might save yourself some escalation time if you just try to search out what you're looking for first and make sure that it's not already there. I think that's all I had today. Unless anybody has any questions, it's the next person.
Can I just
Thank
ask,
you, Sissy.
can I ask a quick question, Anna? Sorry.
Yeah.
Like now you guys, I'm kind of like throwing you guys out in left field here for a second. Okay. So you said the word crisis, Dr. Appelhans, and I was thinking like, is there, I'm over here like looking for Herbalife websites, right? I've been around 19 years. So I remember all the old time Herbalife websites. Is there some sort of like, okay, so there's, an area in we have nutrition clubs in a particular area, for example, right? And so there's an article or something that gets some traction, right? And then what happens is it's a small town and it gets some traction and, these horrible words and diagnoses keep coming up. So people come into the club and they're like, oh, I heard it caused this and I heard it caused this and I heard it caused this, right? And so is there I was like, wouldn't it be great to have a crisis document? I don't know, like a crisis, you get what I'm saying, Dr. Appelhans? I'm like,
Yeah.
like a crisis website or a crisis document that us as distributors could go to that we could possibly, I don't know, show, a customer or a preferred member or a client that we had confidence showing them and that they had confidence that could possibly diffuse some of this language. Do you get where I'm going?
Yes, and the answer is yes, in the broadest sense. And I'll explain. So first of all, I won't say all, but most of the talking points exist in response to most of those concerns that will pop up in that crisis moment, right? Fortunately for us, the media is not very creative, in coming up with new ways to actually implicate our brand. So we've handled most of it over time for the most part. So the good thing that we have is information ready to churn out. So Amber, if you got something and this was popping up, you could say, hey, I'm getting all these questions about that thing, Chris, please, what do you got on hand that's a Q&A about kidney disease? And I'll be like, here you go, Amber, and you can disseminate those talking points down. However, you bring up an interesting point about being able to centralize this information proactively. And that is certainly something I'm working internally to be able to establish, at least for distributors. Obviously having it more publicly facing might, need a lot of legal, MPC, and other reviews. But if we could socialize that information with distributors more readily, that would certainly be helpful. And we realize that. So what I would suggest is further discussion, at the very least at this level, to be able to identify what those tools might be to hang information so that you can more proactively access it.
Okay, that would be great. I'm chatting with the president's team member right now. I'm like, is that good? Like, that would be so helpful. So just, something to consider.
Well, let's get that on our calendars and just start, walking through what those answers look like as far as, how we might be able to use a tool to centralize information and, get you the access that you need. There is a support center, like I mentioned before. So certainly searching some of the more general health conditions like diabetes and kidney disease and a few others can be found there. But the more detailed responses about, progression of disease and how it relates to our product use is certainly something that we can provide. So, let's talk about how the best approach is to making that more accessible.
Perfect. Thank you.
Yeah, you're welcome.
Thank you, Dr. Appelhans. Okay, so that takes us to our quick reference guide, handling negative reviews, health inspections, product safety and groups, and more. So we presented you with a lot of information, and together this team collaborated to put together a one-page resource for you. If we can go to the next slide. And you can't quite see it here, but here's a little tease of what it looks like. But the guide is available on October 28th, and will be available on these two channels. And you'll have information, everything that was talked about, that was highlighted here as to how to respond to social media attacks on your club, on your distributor page, etc., as well as handling government affairs, any health inspector that walks in, media, negative news articles, et cetera. And you also have our, contact information or where to go for more information on here. And we hope that this will help you. We hope that this PowerPoint, our presentation today was helpful. We thank you for your time. Claudia, any other, I think we wanted to just quickly, and I don't know, Claudia, if we still have time for this, but just, here we go. We have the keywords for reviews here. So if, as Amber mentioned, you want to flag these as key messages that, that you pop up that you want to block, I'll go ahead, Amber, if you want to speak a little more to this.
Sure. Yes, you guys. So this is specific to Facebook and Instagram. You guys can check Google. There wasn't a way that I could figure out how to do this on Google, but there is a section on the back end of Facebook. It's easily Googleable, right? Just Google like how to add, what is it called, you guys? Like keywords, I should just Google it and figure it out, you guys, but how to add keywords to Facebook or somebody's going to write it in the chat and help me. Okay. But I can go on the back end of Facebook, block, there we go. Block keywords. That's the word I'm looking for, you guys. I need my Herbal Lifeline. Block keywords on the back end of Facebook and Instagram. Okay. These are the ones that we have for our team. Okay. Now you guys, there's 4 more that on this call that I'm going to add to this list. So you guys take a picture of this. Okay, but I'm also going to add kidney. It's very similar to another word I had on here, but I didn't actually have kidney itself. I had liver. Okay, but kidney. Side effects is another one I'm going to add. Ingredient is another one. And then interactions is another one that I'm going to add. And again, just remember, this is commenting on a post for both Facebook and Instagram. It does not apply to reviews for Facebook.
And I believe Dr. Appelhans added another one. You just said side effects, but she also added sick.
Sick, very good. There's another one, you guys. And share amongst your leaders. And the more that we're all in this together, you guys, the more that we can share, what's going to happen is they're going to find another keyword and it's going to strike, right? And then we have to share that amongst our leaders and our friends. So yes, we want to make sure that we're doing the best to protect our business, whether it's your club page, your Fit Club page, your personal coaching page, from the trolls. Mm-hmm. Oh, there we go. How to block keywords on the back end of Facebook and Instagram. Awesome. Thank you, Laura. Yes, that was my language I'm looking for. What were the 4 additional words? Okay, you guys ready? And the 5. There was 5. Okay, so we have kidney, side effects, ingredient, interactions, and sick. Those are the 5 additional ones we just thought of on this particular Zoom as well. Oh, look at damaging. I hear the word damaging. You guys are just going to keep making a list here. Damaging. But you guys get the idea. Okay, this is a little bit helpful.
I would be careful with the word ingredient, though. That could be taken in a couple of different ways.
What are you thinking?
I could comment, love the ingredients that were put in my shake. I'm making it up because some of these look terrible. There's no question. You don't want to include that, but you want to include that in the list. The word ingredient, I'd be careful with that one.
Or do you have a list of the ingredients? We do get that sometimes on our social media.
Sure.
Provide a list of ingredients is a question.
Best, highest quality ingredients.
Yeah.
Okay, there you go. Scratch that one. See, we're all learning. Okay, thanks. Thanks, Jonathan.
Claudia, did you still want us to go through just our further background or what we do?
Yes, and also just want to make sure, I wanted to share because, so the guide that we actually shared was sent in an email for this call. So you'll see the link on there. We're also working on the 28th. I could share that slide again. I think it was part of this, Anna, that you shared. So on the 28th, it's going to be available on these 2 sections here. So you'll find it on the Nutrition Club page under the operating must-haves, and we'll also have a quick links under the what you need to know. So this guide here will be available there for you to download, and then we will also work on getting this PowerPoint as well, with all those key terms and everything revised, and we can get those out to everyone as well, and also in Spanish. So we'll have that. And then I don't see any additional questions on the chat. So what we could do, Anna, yes, if we could end with just, what everybody's roles and credentials and everything. And we will end with that, but just want to, say thank you to everyone here, right, to Amber for joining us, for being on and, taking us through this and sharing your examples. For everyone here, internal, for guiding us through all of that. It's a lot of information, but very useful information for everyone to have. So we will be including this training in other trainings as well, events, because this is very important to have. So just want to say thank you to everyone for connecting and for all of you that were on the call to listen. So yes, and I'll hand it over to you and we can end with that. Thank you.
Great. So as I mentioned at the beginning of the call, my name is Anna Garcia. I'm the Senior Manager for Media Relations in North America. And Jennifer Butler, who's on the call, I'll let her. She is a VP for Corporate Communications. Jen?
And I run PR and media globally for the brand. And I have a very, very strong crisis communications background. Before I came to Herbalife, I ran media and PR campaigns for big power brands like Procter & Gamble, PayPal, Home Depot, and a bunch of banks. So
Thank you. I didn't give a little, some background. My background is I've done communications for Hispanic Media Relations Agency. And I am a little embarrassed to say, but I used to oversee media relations for NAM for McDonald's. And so I had my fair share of crisis comm there. I've been able to, learn from that and implement that here in North America with our distributors to protect the brand as we did before. Next, we have Jonathan Soleimani.
Sure. Hi, guys. I'm the director of social media. I work as part of corporate communications. I can tell you, all the places I've worked and all the things I've done, but frankly, I'm only as good as the team that I work with. I have a team that has literally decades of social media and marketing experience. I've worked at some of the largest brands in the world, like Nestle, Disney, and Universal. And I've been with the company for about 2.5 years now. I'm gonna pass it back.
Thank
Randall?
you, Jonathan. Let's pass that over to Randall.
Hey, Randall Popelka. I'm Vice President of Global Government Affairs. I've been with the company for about 7 years now. My background is I worked up in the U.S. Senate for 4 different U.S. senators for about 12 years. And then I worked over at the Department of Commerce under Secretary Gutierrez back in the 2010 or 2005, 2010 timeframe.
Thank you, Randall. Next, we have Yoshi.
Thank you, Anna. Hi, everybody. Yoshi Padilla, Senior Director of MPC. I started off my career in sales, was in hotel sales, worked for companies like Hilton, MGM, transitioned to franchise sales. So I have a lot of background in lease negotiations and opening those businesses. Before I landed here, and I started my career at Herbalife here in sales. Transitioned for 2 years. I was in sales, so I worked with a lot of the leadership here. Transitioned to MPC to help launch Nutrition Club kind of rules and regulations worldwide. Then transitioned to the ambassador program, where we created it here, and we brought the ambassador program to North America. And then eventually kind of took over all of the compliance team for North America. But I do agree with Jonathan. We're only as good as the team that we work with, and we've got an incredibly strong team, whether it's in the field or in the office. And quite frankly, you as distributor leadership, we get a lot of feedback from you. And I just got one right now from one of you, and I think it's a great idea. So listen, this is a partnership. We work together, and I'm excited to continue to build it better. Oh, you're on mute, Anna.
Oh, I'm sorry. Thank you, Yoshi. And next we have Dr. Christy Appelhans.
Thank you. And thanks again, everyone, for having me on today. I didn't know that about you, Yoshi. I had no idea you were in sales, but that's good to know. I've been here 13 years, and I am a naturopathic physician by training and by trade. I started off in clinical practice before coming to Herbalife, and it was kind of a good fit, right? Because I'm not only a clinician, but I also have an expertise in botanical medicine and nutrition therapy. I also have an undergrad in nutrition. And then as I came to Herbalife, I was I was a scientist in the scientific affairs team at first, and they said, oh my gosh, you know, why aren't you handling all this health and safety stuff that's coming our way? And I said, wow, okay, I've never done that before, but I think I'm up to the challenge. And so I went back to school and I got a degree in regulatory affairs. So I became a regulatory affairs scientist, you know, to complement the medical expertise that I brought to the table. And from there, I helped grow what is a very robust safety team that handles all of those global inquiries that we were talking about earlier. And yeah, talk about the expertise in numbers. We have an incredible group of experts that's supporting this effort, and I think that that's definitely what helps make us all successful now. But yeah, and I welcome, by the way, all the feedback and all the innovation that's coming out of these processes. So I think one of the greatest parts of the job is being able to learn from distributors. So we learned today and we continue to learn to make sure that we can just support you in the best way possible.
Thank you.